Hi, I'm Lacey Nobles with the City of Lubbock. Our news conference will start in just a few seconds. Good morning, and thank you for joining us for the City of Lubbock COVID-19 news conference. Today, our panelists are Director of Public Health, Catherine Wells, Public Health Authority, Dr. Ron Cook, Texas Tech University President Lawrence Skubanek, Lubbock Christian University President Scott McDowell, and Lubbock Mayor Dan Pope. So let's start with Catherine Wells.
Good morning, everyone. It's good to be back. Our case numbers of COVID-19 here in Lubbock continue to be manageable with between 100 and 200 new cases a day. We need to continue to keep the case counts in this range or lower. We cannot afford to let our case counts increase again. More cases leads to more severe disease, and ultimately we have a greater risk of losing more of our loved ones. Today, I really want to focus on our vaccine clinics. Since the beginning of the pandemic, we have talked about the tools we have to combat the spread of the virus: social distancing, hand washing, wearing a mask. Vaccines are another tool, but it's going to take time and manpower to vaccinate enough people to reach herd immunity. And when we reach that herd immunity, that's when we can begin to drop some of these mitigation methods, such as wearing a mask. But until then, we need to continue to follow that hand washing, social distancing, and wearing a mask. Last week at the Civic Center, the Health Department and Lubbock Fire and Rescue, along with many volunteers, administered 5,081 first doses to individuals in our community. On January 15th, we received notification that another allotment of 5,000 doses would arrive this week, and we were able to reopen registration. Appointments for all of those doses are now full, and we are currently in the process of vaccinating everybody that scheduled an appointment last week. The communication from the state is positive, and we hope that we will continue to receive a large quantity of vaccines each week. The health department will reopen scheduling for first doses as additional vaccine allotments are confirmed. Scheduling will be available through Select a Seat or by calling the health department. However, we can't open up those slots until we know how much vaccine we're going to receive for the following week. Those first clinics at the Civic Center were back on December 28th. At that time, DSHS had limited the amount of who we could vaccinate to the group 1A. So at that time, we could only vaccinate our healthcare workers, home health, etc. Later that same week, they opened up who we could vaccinate and increased that so we could start targeting those over 65 or those with high-risk medical conditions. It is now time for those individuals to start receiving their second dose. Starting next week, the health department will be running a second dose clinic concurrently with first dose clinics. Next week, we're going to focus on second doses for those individuals who were vaccinated prior to January 31st. This is going to allow us to get all of those healthcare workers that have walk-in appointments that first week, make sure that they get their second dose. Then, starting the first week of February 1st, the health department's going to move to a standard clinic schedule at the Civic Center. And this will allow us to accommodate both first and second doses with the capacity to administer over 10,000 vaccines a week. Our goal is to vaccinate 5,000 first doses and then bring in 5,000 people for the second dose. Each week when we get our vaccination allotment, we will reopen registration for those people wanting to get their first dose. And then those who need their second dose will be able to schedule their appointment through the health department or Select a Seat. And there will be a separate option on the Select a Seat page to just make your appointment for that second dose. Our plan is to begin to run clinics regularly, and we're looking at operation on Tuesday from 10 to 3, Wednesdays from 10 to 3, offering an evening clinic on Thursdays by running it from 2 to 8. And then we're also looking to open a Saturday clinic, which will allow us to meet that 10,000 vaccines per week threshold. We're really excited about offering this to the community, and hopefully we'll continue to receive these large allotments from the state of Texas. And as soon as we get notification of that vaccine, we are we'll go ahead and allow everybody to begin the registration process. With that, I will pass it over to Dr. Cook.
Thank you, Catherine. And that's a yeoman's work down there. That is excellent work. It makes us look good. Appreciate all that hard work down there and all the people that have volunteered so far to come help with that effort. Good citizens of Lubbock, our hospitals remain full and our ICUs are full despite our numbers going down with COVID. Just last night, you can look on the city's website, there were 23 patients that needed a bed in the hospital that couldn't be moved out of our emergency room because our hospitals and ICUs remain full. Even though our COVID numbers are decreasing, that just goes to show how important our healthcare systems, our hospitals here in Lubbock are so important for the sick and injured, not related to COVID. We must continue to do our effort to slow down this virus. I believe this is progress, but we can't relax. We cannot let our guard down in preventing this disease that causes death and long-term illnesses. We must continue to respect this virus and its potential to be lethal. Good news is we're getting more vaccine, as Catherine just described. We're also continuing our antibody infusion clinics. So if you're tested positive and you're high risk, those individuals that are greater than 65, have uncontrolled diabetes, have hypertension that's uncontrolled, have an immune disorder or chronic kidney disease or obesity, please talk to your primary care physician or provider about getting infused with that drug. It's very safe, and it looks like we can contribute some of our decreasing hospital numbers and ICU numbers to our infusion clinics as well. So that's good news. That's excellent news. Those of you that have received your first dose of the vaccine, please make sure that you get your second dose. It's a 2-dose series. To get to that 94% effective rate, you must get your second dose. It's safe. It doesn't get into your DNA. We've had very few reactions to it. Most of them have been very, very mild. You will probably be a little more sore at the second dose than you were with the first dose, but that's not an allergic reaction. That's a normal response to your body's immune system building up antibodies and building up a defense against this virus. So you must get that second dose. Let me reiterate that you must get that second dose so we can get to that herd immunity. In the meanwhile, just because you got the dose of vaccine, you must continue to wear your mask and socially distance. We don't know if you could still carry the virus and infect other people. So as we talk about this virus, you may have heard about the new mutations, the more infective forms of this virus. It's been found in China and the United Kingdom. 2 mutations have been found in Brazil. It's been found in South Africa. It's also been found in California. It's been found, 2 variants have been found in Ohio and here in Texas. There may be some concern that we're going to see another surge related to this mutation because it's about 50% more infectious than the original virus. That concerns us because so twice as many people can get infected with this virus. And if twice as many people get infected, that means twice as many people get sick, twice as many people may end up in the hospital. We don't want that. We're just now getting our numbers down. Our hospitals remain full. So we must continue. The only way that we stop this and slow this down is to continue to wear our facial coverings, our social distancing, washing our hands, keeping our groups small, and just be very, very cognizant. Don't become immune to the potential of this virus causing disease. With that, I'm happy to answer questions at the end. If you're tested positive, make sure you stay home. If you've been exposed, get tested so we can take good care of you. Be blessed. And let me hand this off to Dr. Skovanec. President.
Thank you, Dr. Cook. Today, we welcomed our students back to campus for the first day of classes. In spite of the challenges of last fall, it doesn't seem that dealing with the pandemic has affected our enrollment. As of today, we're about 5% higher in enrollment than we were a year ago. We have noticed, however, that the retention of first-year students is slightly down, and we do believe in part due to dealing with the complications and challenges of the pandemic. We did eliminate spring break where we reduced it to 1 day. That's why we're starting 4 days later than planned. But we have added what the students are referring to as a wellness day. In February, we will have one in March and then also in April. So we'll have 3 weekends, 3-day weekends with no class on Friday. And we feel that will provide an opportunity for students, faculty, and staff to refresh and refocus. We're very grateful that the Texas Department of Emergency Management is back on campus. They have a new location. I think it's more convenient. It's across the street from the sub. Last fall, TDM conducted about 2,000 tests a week for us. Between the testing that was done at TDM, our wellness center, and HSC, we tested a little over 30,000 students, faculty, and staff. And we will again be offering free walk-up testing. We are aware that there are certain mental health issues that have appeared among our student and faculty and staff, and we've tried to respond to that. We'll be providing more opportunities for engagement in open areas around campus once the weather makes that feasible. We'll be having enhanced Wi-Fi in areas where they can gather in a safe way. Also, our Office of Risk Intervention and Safety Education has increased their communication to everyone about the opportunities and resources for that deal with issues of health and wellness. We are very grateful to the city and the way they have accommodated us in many ways, but most recently in providing vaccines. We created a link where students, where faculty and staff can sign up when they want to be vaccinated. That link went live on Friday. As of yesterday, we had over 300 people who've already signed up. And we will, as we can, facilitate access to vaccinations among our faculty and staff. And with that, I am going to turn this over to my friend and colleague, President McDowell.
Thank you, Lawrence. We at Lubbock Christian University have started our second full week of classes. I'll echo what Lawrence said in terms of our gratitude to the city, Mayor Pope. We've been able to set up a testing site on campus at our Rip Griffin Center and are leaning into that. Our approach all along has been to be evidence-based in our approach, to really listen carefully to our local authorities. We've leaned into Dr. Cook and others and are very grateful for their guidance, and of course, to be guided by our Christian mission. So we have had good compliance in terms of students really caring, even though they're at a low risk, for their faculty and staff and others. And so our protocols have worked fairly well. Typical week, less than 1% of our campus would have cases. Not a single one of those cases was traced back to the classroom. So we like to say the classroom is probably the safest place to be. But we continue those protocols, simple things like hand washing, the social distancing, the wearing of masks, all the things that have become familiar to all of us, but we're staying vigilant about that. The calendar at Lubbock Christian is staying the same because of the nature of our smaller institution. We have not discovered any bumps in cases with breaks, and so we are keeping our regular spring calendar, and that's available on our website. The biggest differences from the fall to the spring, again, in adjusting is coordinating with the city to have the testing site at our Rip Griffin Center that is available for drive-through testing, and it's free. Certainly managing the events like our basketball and baseball and volleyball events, practicing social distancing there. And we've got a big spring musical that we have changed over and done completely virtually. So we're making those adjustments. The campus is responding well. We, again, just feel like things have gone well, and I'll field any questions when we get to that point, but grateful again to Mayor Pope and to the city. And I'll pass it back to the mayor right now.
Thank you, Dr. McDowell. Good morning, everyone. It's great to have partners like Lubbock Christian University and Texas Tech University. You can sense that by hearing what their leaders said today. And I just am thankful for those men and the institutions that they lead. They're great partners. I'm going to share my screen real quick and run through my data slides. Okay. So hospitalization rate as measured by the state, this is COVID beds as a percentage of total beds. You can see that our trend line is very good. We got down a couple days last week, close to 15, bounced back up. We're right at 20 today. Remember, this is for the entire trauma service area. So Lubbock's numbers have come down, but this is a bigger area than just that. We'll talk a bit more about that in a minute. Case count by age group. So you can see the distribution is similar. The numbers are smaller. Over the last week, we've averaged 137 new cases. Over the last 2 weeks, it's 175 new cases. Those of you that have followed this know that that's a significant change. It's going the right direction. We're very thankful for that. Hospital beds, a little different kind of story. Remember that even though our COVID demand on the hospitals is going down, this is the time of the year that the hospitals have their largest censuses. They have demand for other care, emergent care, other type things that happen that people need to be admitted for. And remember, we serve not only Lubbock, but a huge geographic area. And you can see that the last 2 evenings we've had patients holding for hospital beds. Finally, city clinic doses administered. You can see that last week we did 5,000, right at that 5,000 number. We did another 1,475 yesterday. We'll do a similar amount today, if not a little more. Tomorrow will be a little larger. We expect, just like it was last week, as we pick up people after work. I had a chance to visit that clinic last week, and I'm going to comment on that in just a few minutes. Okay. I first of all want to express empathy and concern to the impact COVID's had on families and businesses. It's hit us all. Just this week, I lost a friend, and so our prayers and thoughts are with those families and they've lost their loved ones. Also, those where their businesses have been significantly impacted. Our hospitals are getting better from a COVID perspective. 2 months ago, we had about 320 COVID patients in Covenant and UMC. Yesterday, that was 195. Less than 60 patients were in ICU yesterday. Those are really good trends. You know, the antibody infusions seem to be working, that therapeutic. In fact, just a few minutes ago, the governor announced that the state is opening with our participation, an infusion clinic, a therapeutic infusion center here beginning later this week, I believe on Thursday. It will be at the Old Grace Hospital at 50th and University. I'm thankful for the partnership of Covenant Health in offering that up. It will be important that that partnership with Covenant and UMC continue to work as we send those patients from primary care physicians to get this infusion therapy, with the idea being that we keep them out of the hospital. They can recover at home. There'll be more press about that in the upcoming days. I had a chance Thursday afternoon to visit the vaccination clinic, and it was remarkable. We had a number, probably close to 40 Texas Tech med students there, first, second, and third year, I believe, and just the young, bright, energetic students helping out. It really added a great vibe to what was going on. I talked to Dr. Rice Spearman at the Health Science Center yesterday, and she talked about how much the students wanted to be part of this. And we're so thankful and we're so fortunate to have them. And in addition, you have people like Dr. Cook's nurse was there, and she came up, introduced herself to me, and she was wearing her Dr. Cook t-shirt, you remember the virus ain't got no legs t-shirt. And Douglas Klepper, Dr. Klepper, who's a pediatrician in our community and beloved doctor, was there, giving of his time to vaccinate people. You had our Lubbock Fire and Rescue folks there and city employees, in addition to Ms. Wells' health department, making this thing work. In fact, Mayor Pro Tem Maskill shared a text he got yesterday from somebody who was vaccinated who compared our clinic to a Chick-fil-A drive-through. Now, I'm not sure we're at that level, but that's pretty high praise, and I'm proud of our team, but the many volunteers that are making it work so well. It's what makes Lubbock a little different. You don't have to look around the state very far to find cities struggling to get this done. Lubbock is not one of those situations. We're not going to rest. We expect increased supply, hopefully as soon as the first week of February. And we are working for that. As I've said the last several weeks, planning is the best antidote to panic. We don't want to wake up on a day and understand that our supply might double and not have a plan. We will have a plan. We're working with partners in that regard. We hope next week at our press conference to roll out some more information about that, but bring on the increased supply. There's a better day in our future. I encourage each of you to continue to follow your safety protocols, but most importantly, be hopeful, be kind, be safe. Lacey, back to you.
Thank you, Mayor, and thank you to our panelists. And I'm going to ask everyone to turn on their cameras and microphones. We're going to open it up for some media questions. And today our order is El Editor, the Avalanche Journal, KCBD, the Daily Toreador, Latino Lubbock, and Texas Tech Public Media. So let's start with Olga Guerrero with El Editor.
Hello, everybody. Good to see everyone. It's a beautiful day today. It's bright and sunny, and it's good to say that I'm proud to be part of Lubbock citizens. With that being said, I would like to say thank you for the opportunity to always give to the media outlets to voice their concerns and voice their questions of people that we have on their behalf, being the voice of the voiceless, if you'll allow. The first question I would like to maybe say is, or ask is, what would it take for the health department or the city or other entities to take to consideration maybe organizing and getting
Olga, we lost you. Yeah, if you can hear us, we've lost you.
compared to other cities that they do take pre-registration before they even know that how many vaccinations they have. People are saying that United Supermarkets are more professional in processing and getting people, vaccinated. With that being said, we just need to hear and listen and try to do other things that we can. So is there room, Catherine? Do you see that could be done? I mean, like Midland, Odessa, these people take calls to avoid people trying again and again because they don't get an answer. And they would like, when they do get an answer, to be put in a pre-registration list. That way they'll know that they are going to get it instead of calling every week and going through the same routine. It's sort of frustrating for those people, especially the elderly, especially those people over 65 with underlying illnesses or something like that, What do you say to that?
I mean, the health department's always open for ideas. We have made changes based on comments from community members and suggestions. Even scheduling just for 1 week, we end up with a lot of cancellations because people also get into their doctor when they make their appointment with the health department. And I'm really concerned about scheduling out longer than a week and the number of changes and trying to rebook appointments at different times.
Okay. All right. The second question is,
Olga, are you still there?
yes, I'm still there. I guess, did y'all hear me? I'm sorry.
No, we didn't.
Oh, I'm sorry. I didn't even say it in Spanish. Hello. I was asked get the vaccine on the same arm that you got your first one.
So Olga, you broke up again. So are you asking what's the preference about the spot to where to get the vaccine if you got it on the same side or not?
Yes. Should you get the second dose on the same arm? And should you get tested for COVID-19 before receiving the vaccine? I'm
No.
sorry.
Yeah. So Olga, no, you shouldn't get tested before you receive the next vaccine. The other thing, it doesn't matter which arm you get it in. I would say if you sleep on one side, if you sleep on the right side, I'd get it in the left arm, just because it might be sore and so you can rest more comfortably at night. So whatever it doesn't really matter.
Just get it in.
Get it in. Get that second dose. That's the important thing, Olga.
Thank you for your efforts. Thank you.
Thank you, Olga.
Thank you, Olga. Now we have Matt Dotre with Lubbock Avalanche Journal.
Good morning, everyone. Ms. Wells, can you just talk a bit about how, I guess, the city is ensuring that the citizens needing the vaccine the most are getting it first? I've heard stories of people at dentist offices and grocery stores getting vaccinated because they're essential workers. But my understanding is that it's not open yet to essential workers. It's still just the 1A, 1B groups.
Correct. And the city clinic is working to make sure that we follow those guidelines that are set by the governor and the vaccine task force. And people are, by purchasing or by getting a ticket through Select a Seat, you are agreeing that you meet that qualification. If you call the health department and make that appointment, staff do ask those questions. We're also being trusting of the community. If it's your time to get in line for your vaccine, we want you to come to the clinic. Those who are in other groups need to wait. And we will continue to keep this clinic going as long as the state provides vaccine. And, the goal is eventually to get everybody in Lubbock vaccinated.
Sure. Okay. Thank you. And Dr. Cook, can you talk a bit more about this infusion center? I guess, and what that's going to do to hospital capacity? Are these going to be new beds available, or are they just kind of shifting resources from one place to another?
No. So we have at least 2 sites already. each hospital is infusing. Each one of them has about 14 beds that we're infusing patients in on a daily basis. And it takes 2 to 3 hours or so. By the time you get registered, by the time you show up and get the IV started, and then infuse it, and then watch you for a little while after the infusion, it takes 2 to 3 hours. So there's about, we can do a turnover twice, so each site could probably do at least 28, maybe a little bit more during the week on each one of those sites, so per day. So that's this infusion center and its impact on the hospital. It looks like we've infused enough people now, well over 1,000, that it looks like it's making a significant difference in keeping patients. The whole goal is to keep those high-risk patients out of the hospital.
And Matt, the center that the governor announced today will be new infusion beds. So we're not displacing other beds, new beds.
Okay. Yeah, I appreciate that. So I guess it's not like an overnight thing, I guess was my misunderstanding. They're just going to go get this infusion treatment for like 3 hours and then I guess go back to the hospital. Okay.
And we have plenty of the drug. So please, if you fit into those high-risk categories and you're positive, please call your primary care provider and get registered to get the drug. And the sooner the better.
Remember that, Matt and Ron, correct me if I'm wrong, but that we want to get that infusion therapy in someone in the first 5 days after they test positive, if they have the underlying health conditions. Is that correct?
That's correct. Absolutely.
The idea is to keep people out of the hospital.
Thank you.
Thank you, Matt. Now we have Karen McKay with KCBD.
Good morning, and I'm wondering that the CDC is reporting an increase in COVID cases in children with over 200,000 reported last week. So can you give us an update here locally on the situation with children and the severity of cases here?
Sure, Karen, thank you. I can help with that. We have seen a number of cases here in Lubbock. As you know, most children do very, very well with this virus, just a mild upper respiratory infection and symptoms, and doesn't go much further than that, even if they're even symptomatic. Even children, especially young children, don't really transmit it to other people. As if I were to have it, I would be highly infectious to somebody else. The concern is, the biggest concern, there has been an increase in the number of children that were hospitalized. And yes, we include children up to the age of 18. And so there's been a number of individuals that have been hospitalized. I'm told it's about 3 to 5 or 3 to 7 per week in our community. And our surge started before Thanksgiving. There have been a few that have been hospitalized with this condition called MIS-C, multi-system inflammatory syndrome, -C, which stands for children. We see that in adults. We also see that in children. And just like adults, many of these children have a prolonged hospitalization. Some of them get out pretty quick, but some of them do have a prolonged hospitalization. Just like in adults, we call them long haulers, those that continue to have symptoms or slow resolution of their symptoms over weeks or even months, and cardiac issues and those sort of things. We're seeing the same thing in children. So all the more reason to do your best to protect your children from getting this virus.
Thank you, Dr. Cook. And also I have a question for our college presidents. Thanks for joining us today. And of course, there's a concern, as the kids come back into school, that there could be greater exposures in the community. So my question is, what arrangements have been made now for these students who will need to quarantine? Are you actually using hotels, or what is your plan of action there?
Scott, I'll go ahead and answer Karen first. Just as we did last semester, we have reserved some rooms on campus, some rooms outside of campus to isolate students who test positive. We have about 300 such rooms, and we never exceeded that limit in in the fall. With regard to quarantining, as you may be aware, the CDC did update its guidelines for quarantine procedures, and we will be following those new protocols for asymptomatic students, faculty, and staff that reduces the quarantining period from 14 to 10 days or 7 days, depending on whether they have access to testing. But I do believe that in terms of how students affect the community, we just have to continue to message that we must be responsible and thoughtful in our actions and our behavior. And we did have issues at the beginning of the semester, but I was very encouraged by the numbers and such towards the end of the semester. And I believe our students in the community takes us all very seriously.
Yeah, the only thing I would add, I again echo what Dr. Skuvenik said. We've got facilities on campus that we've set aside for the quarantining, for the isolation, and we never exceeded those numbers. The community rallied really well, served something like 3,000 meals to people that were in quarantine. And again, we're just maintaining the messaging about vigilance with the testing site on campus. We're encouraging more testing, and so we feel pretty confident that the protocols are working, and we will continue to be vigilant.
Thank you both.
Thank you, Karen. Now we have Chase Seabolt with the Daily Toreador.
All right. I know earlier, Ms. Wells, you briefly mentioned about 10,000 vaccinations per week is kind of like where we'd like to be sitting, including the Saturday vaccination clinics. Are we planning on getting more vaccinations from the state? Because I thought as of right now, we were only getting about 5,000 a week.
Well, we're receiving 5,000 first dose
Okay.
vaccines, and then we will continue to receive 5,000 second dose. So as long as the state guarantees the second doses. So as long as we continue to see somewhere around 5,000 doses a week, we have to have that clinic planned and have the ability to run 10,000 people through there per week.
Okay. All right. And then this one is from Mayor Pope. Could we get a little bit clarification as to why some of the local bars are still open, even though Executive Order 32 limits their occupancy?
I'll do my best. The state worked with our restaurants and bars throughout 2020 to allow a number of them to change their license. I think the basics of it are they're having to serve food to be able to serve alcohol. And therefore, they've been able to remain open as long as they're able to follow the guidelines of the governor's executive order. We had the Texas Alcoholic Beverage Commission was in Lubbock 2 separate weekends in December, and they visited every licensed restaurant. Everybody had an on-premise alcohol permit. I believe was visited more than once, and over those 2 weekends. That's the state's enforcement, not ours. They license that, we don't. But I think that's Chase. I believe that's the basics of the reason why.
All righty, thank you.
Okay. Now we have Christy Martinez Garcia with Latino Lubbock.
Good afternoon, everybody. I wanted to ask, with the second mutation, Dr. Cook, what is the city doing? And Catherine, Mayor, if you can all kind of contribute to this, what are you doing? This, I guess, is a downtime. It's an opportunity for us to be prepared or cautiously optimistic, as Catherine often uses, to avoid some of the deaths that we've had and the high numbers. What are we doing so that we will be prepared besides what people have to do on a personal basis? What is the city going to do?
Christy, I'll start with that. This isn't, we're doing our best. This is a personal choice to not spread the virus. it is a personal choice to wear a mask and socially distance and not gather in large groups. That's all we have to stop the spread of this virus. Until we can get to herd immunity, the city's working hard to get 5,000 doses a week and another 5,000 doses for second vaccinees, people that are getting their second doses, trying to get to herd immunity. But until then, the only thing that we have are physical barriers, and that's the facial covering, and it's the social distancing and washing your hands, staying in small groups, not gathering inside with a bunch of other people. You've heard me talk about how my family did Thanksgiving and Christmas. These are different times until we can get enough people vaccinated to stop and slow the spread of the virus. It's a personal choice of every citizen in our community to make that decision.
Catherine, you want to add anything to that, Catherine?
I echo Dr. Cook. We need to continue to push out that message about the masking and the social distancing. And really those are the two, plus the hand washing, are the things that we have to reduce the spread right now.
I think the other thing that I would build on that is, Christy, we have once we get through January, we start to have a lot of events that we normally traditionally have, and through the spring. And a good example is the Hospice of Lubbock's Mayor's Beans and Cornbread luncheon, which is their primary fundraiser for the year. And we're not going to be able to do that this year. We're using the Civic Center for vaccinations, and they're finding a different way to do it, sort of a drive-through way of doing it. But there'll be a number of events like that, much like LCU and Texas Tech have adjusted basketball and will adjust baseball. There'll be a number of those type things that we'll continue to do to try to keep people safe. Thanks for your question, by the way. It's a good question.
Thank you. Dr. Skovanec, I wanted to follow up with you. I know that you said you had about a 5% increase in enrollment, but what I want to know is how many of those that have enrolled are actually going to be on campus, and what is going to be the distance? How many are going to be the distance learners? And I do want to ask you, because you also mentioned retention. So if we can, we may have to talk afterwards in hopes that we can discuss that a little bit more at length.
Okay. So Christy, we have around 7,000 students in the dorms, similar to last fall. But in terms of the students that are in Lubbock, the number is much larger. Very similar to what we did in the fall, about 70% of our classes have some degree of face-to-face. About 40% are fully face-to-face, 30% is hybrid, and 30% is online, purely online. I would say that the majority of our students are either on campus or in the community, in spite of the online modalities. Did that answer your question?
Yeah, so let me ask you real quick, because, we just heard from Dr. Cook mention the mask. Is that still going to be mandatory on campus?
Yeah, I should have made that point in my opening comments. Every protocol that we instituted as part of the TTU commitment is still in place. Just today, I released a video to the community saying that in spite of the opportunity to be vaccinated, we can't let our guard down. We have to continue to respect social distancing, wear the mask, follow good personal hygiene. So all of those efforts are still in place. There's been no relaxing of those protocols.
It's important just to welcome back the students. So we're glad that they're back, but we appreciate all that you guys are doing. And Catherine, we've heard so many positive comments about how the vaccine clinic is going, but they're still complaining about they can't get in, but we're doing our best to help. So thank you all for what you're doing.
Thank you, Christy.
Thank you, Christy. And finally, we have Sarah Self-Walbrick with Texas Tech Public Media.
Hi, everyone. Happy Wednesday. My first question, our new case numbers have been lower, but we've also seen a pretty considerable drop in the number of COVID tests being done each day so far in January. What is contributing to that lower testing rate?
Ron, why don't you start with this one, and I may have to offer a non-academic answer to this, but why don't you start and give the real wonky answer?
Well, certainly the less you test, the less you're going to find positives. I mean, but we think that our community is doing better, and hopefully the number of people that are sick are becoming fewer and fewer. That's the goal. We hope that continues. But the other side is, I'm going to say, as you know, you can quote me and regurgitate it yourself, wear a mask, socially distance, and wash your hands. We got to keep this up. We can't become lackadaisical about it. Mayor?
Yeah, I mean, as the spread slows, fewer people are going to go be tested. And when you have a positive test, it has it's not a one-to-one kind of impact. It's nearly exponential on your number of tests taken because there's the exposures when you do your contact tracing. So it all feeds itself. It makes sense that you would have fewer tests when you have fewer positives. We're looking at the positivity rate. That's also another bit of good news. It's not where we want it to be, but it's much lower in the last week or so, last 10 days than where we were in all of November and December.
Okay, thank you. And then my second question, shifting gears to the vaccine. I know 2 people who have tested positive for the coronavirus after getting their first dose, which, as we know, is only so effective until you get that second shot. What do people need to do after getting the first shot to avoid that situation? And what about the second shot if you do test positive in between doses?
So I'm happy to answer that, Sarah. That is very likely. I know of a few individuals that got the dose or got the vaccine, then got COVID. They could have even had COVID at the time they got the vaccine, but your immune system, it takes 2 to 3 weeks to start building immunity to the virus. And it takes that very important second dose to continue to push your antibody levels, your immunity up to that 94%. So it takes 6 weeks after your very first dose, at a minimum 6 weeks, to have an immunity at 94% or so, 95%, to protect you. If anywhere in between there, you get exposed, of course, the further you get out to 6 weeks, the less likely. There are no guarantees in life. 2 things we never say in medicine: that you never say never and you never say always, because as soon as you do, somebody will come up and prove you wrong. It's 94%, 95% effective. That still means 5% are out there that had 2 doses that are greater than 6 weeks out that might get infected with COVID. But the likelihood, so if we get to herd immunity, the likelihood of even that person spreading it to somebody else is very, very low. So it can happen, and it should not deter you from getting your next dose. So you may have a little bigger response to the vaccine. In other words, the chills and the low-grade fevers and the muscle aches and soreness in your arm. That's maybe very likely, but let me encourage you to get that dose. It's the same reason why if you had the chickenpox, we still want you to get the shingles vaccine, because it could still come out. So we want to make sure that you get the second dose.
So big point is we can't let our guard down yet, even as we get these first shots. Thank y'all so much.
Long ways away from that, a long ways away from that.
Thank you, Sarah. This concludes our news conference for this week. Thank you to our interpreter, and thank you to our guest panelists and our normal panelists. For more information on the city vaccination clinics, go to mylubbock.info/COVID-19 vaccine. Have a good